We have fellows who start in the research lab here in the Gynecology division, which I think makes us unique, that the Gynecology research lab is embedded in the division and in the building.
The first year is a research year, followed by 2 clinical years. And the first year is fully enveloped in research, at the bench, doing bench research, animal research, whatever projects we have going on at the lab at the time.
We're super excited that we can do that direct translational research that ultimately brings discoveries back to our patients. And then we transition into 2 years in the clinic and OR with our Gynecology team. We are a very close-knit team, a close-knit family. Our nurse practitioners have been with us for greater than 10 years. It's a very close-knit group, and we've really embedded the fellows into that seamless team.
As the first-year fellow, I am mostly research. However, I do take call once a month and will also double scrub cases with my senior fellows if they're unique or interesting, such as we had a pelvic exoneration this year, which the senior fellow walked me through part of that, which was great. It made me excited to transition to the clinical years of fellowship and made me excited to feel like I'm going to get good surgical training here and be well prepared.
From a clinical perspective, our fellows are in the clinic with us weekly, and I think this really helps to round out your practice. You will spend half of your practice in the office taking care of patients and talking to patients, counseling them on their chemotherapy and treatment. We want to make sure our fellows are ready and able to prescribe and deliver chemotherapy and practice the full scope of gynecology. And then we move on to independence in the operating room. So our fellows move from being the surgeon with the attending at the bedside to being the teaching surgeon in our cases, all the way through those radical surgeries where they are teaching a junior fellow sometimes how to perform those cases. And our goal, of course, is for our fellows to be independent surgeons. Prior to their graduation, they will have already been able to perform those surgeries independently.
So my approach to teaching is to let people make mistakes, and I always tell someone that is new and learning that any mistake they've made, I have most likely made the same mistake multiple times, so there's nothing too stupid that can happen. And along those lines, I like to show them how to do things at least once and then be there while they're doing it. And then after a few times of doing procedures, then usually the fellows take on very quickly.
During our first year, we do spend a lot of time in the lab working with Dr. Lee, where he helps you either continue on a project that's already ongoing or you develop a new project with him that's more basic science or translational related. I had the opportunity to present that work at multiple conferences this year. I had a poster at SGO, and I also had a poster at the AACR annual meeting for my basic science work. And then there is also opportunity to do clinical research even as a research fellow. I did a clinical project that I presented at a regional conference back in the fall. And I'm currently working with Dr. Pierce on another clinical research project using the Alabama Cancer Database.
I think our fellows are all very independent, self-starters and independent learners. I do think that gynecology in general requires an ongoing commitment to your own betterment and your own learning. But obviously we want to continue to cultivate that in gynecology and make sure people understand the nuances of some things that you might learn in a book aren't always directly translatable to the bedside and the art of medicine. So we want to make sure people are open to that, open to learning kind of the nuances of how to care for people from different backgrounds, people from different cultures, and to make sure that everybody is open to learning those things and to come to Mobile with an open mind and a heart of service. You can't do better than Mobile for a fellowship experience. It's a progressive coastal city that's small enough to be easy to get a dining reservation, but big enough to have a symphony and an opera. I think it's one of those places that there's always a festival, there's always something fun going on downtown. Of course, the beaches are about 40 minutes away. There's rivers for paddleboarding and kayaking. There's lots of hiking trails and biking trails. Just really anything that you would want to do on the coast, you can do here. Mobile is the original birthplace of Mardi Gras in the United States, and so our Mardi Gras is a little more family friendly than the one in New Orleans, but just as fun. And it's a real celebration of the town and what the town has to offer from food and culture and history, as well as letting the good times roll.
As far as advice for someone that was looking to be a fellow here at MCI, I would say to just be really open. We see a very sick patient population, a vulnerable patient population, and there's a lot of opportunity for research there, as well as opportunity to learn how to care for complex patients.